we found this this technology, the very first of its kind, that has achieved the not only patented but the FDA approval to be. So now that's important, right? Because now if it's approved by the FDA, we can now bill for that.
Yep.
Yeah. But it's this medical device that does this amazing thing for patients where it increases their vasomotion, their circulation by 30%. You're getting more oxygen and nutrients at the cellular level.
They turned down the thermostat.
Yes, if you hear us sniffling, it's because it's
cold
like,
in here.
It is cold.
I'm
I'm
thinking my blood's moving.
Yeah, which is why he's extra giggly.
All right, so keep going. Sorry. So we have this device, and what's it look like? What's it do?
It's a small computer that has 2 ports on it. One has imagine like a really high-end yoga mat. But the yoga mat has coils in it. The patient lays on that and gets this improvement in circulation all through their entire body. Or there's attachments where you can do spot therapies. So like if somebody's got a rotator cuff, you just put it right on their shoulder and focus on that area.
Is it magnetism or what's it putting through the body?
Bioelectromagnetic energy. Bioelectromagnetic energy. First of its kind to get FDA approval. Professional athletes have been using it for years. The San Francisco 49ers are advocates. They use it. The Diamondbacks here in Phoenix use it. A lot of pro athletes, Mike Weir, Phil Mickelson. The list is like super long.
And who invented this?
It's a German company.
Okay.
It's out of Germany. German engineered, Swiss design.
And so y'all are marketing that in the United States? Is that?
We're just introducing it. We're introducing it to pharmacies to set up these health hubs, because there's actually this whole program, this new health hub that can compete with minute clinics, with the Village. You saw that Walgreens just spent $8.9 billion on health systems to compete with Minute Clinic. Our independent community pharmacies will blow them out of the water. Both of those Minute Clinics, they're still looking at healthcare, at treating the smoke. Oh, let's take care of the smoke. They're not doing anything about the fire. And we see technologies that are actually preventative. They're actually getting in there to the cellular level. If you trace back to where disease states come from, over 90% of them come from where? Come from inflammation and poor circulation.
Stress.
That's over 40,000 diseases come from that microcirculation area. So you have these patients laying on these med beds. It's another company we bring in, the BioLight guys.
Yeah, we've had them on the podcast. Yeah.
The patient walks out of that session, totally electrolytes 100% at par, hydrated, floating on air. The med bed gives them an increase in ATP, that's energy in your cells. So they feel euphoric.
Do you like the BioLight? I know you're going to say yes.
I do.
Which is your favorite flavor?
Yeah, what's your favorite flavor?
I think it's the berry. It's berry's my favorite.
Okay.
The melon is growing on me. It was a little strange at first, but yeah, I think berry's my favorite.
Berry, okay.
I think melon was the one that I tried.
That was a little strange. Maybe we'll have to try berry.
Yeah, maybe we have to try berry.
So what's the name of the mat? See, he's drinking it on screen. Is that the melon that you were drinking?
No, that's the berry.
That's the berry, okay. Yeah. So they're all different. They have different strengths of electrolytes and different flavors. So we'll have to try a couple of different ones when at the show. So what's the name of the mat?
So it's Bioelectromagnetic Energy Regulator.
Okay.
But they just shorten the acronym to BEMER, BEMER.
BEMER, okay.
Yeah,
BEMER.
I thought about it. The one that we saw in London, there was the salt rocks in it that they were using as also the heat pad, because you could see in it, and it wasn't electrotherapy like what he's talking about.
Yes, this electromagnet. Is there any heat or anything in addition to the electromagnets? Just pure. I'm not feeling anything.
Yeah, people will express that they feel a warming sensation, but that's probably just because they had horrible circulation and now blood's flowing. But the technology is so advanced that there's a collaboration with NASA right now to embed it into the astronauts' spacesuits.
Oh, yeah.
Because they can stay in zero gravity longer. If you stay in zero gravity too long, you get sick. You get space sick. Yeah. You need that gravitational pull. And this is being built right into the suit now. The athletes are using it for recovery, right? So if you have a really hard game, you built up a bunch of lactic acid, or you may even have micro fractures. If you're a quarterback that just got hit over and over and over, Tom Brady, he uses that device. Yeah. It actually heals those micro fractures as well. So the studies are incredible. Most of them come out of Europe. Because they're using it over there in the hospital systems. They put it in babies' incubators over there because of the, preemies, because of how it helps with the whole regeneration of cell growth and everything. But, why did it take 20 years to get FDA approval here in the U.S.?
Because FDA approval takes a long time.